Welcome to The Explainer. Today, we're going to break down something that so many families deal with, childhood asthma. We're going to get straight to the facts, what it is, how it's managed, and, most importantly, how kids can absolutely thrive with it.
So, just how common are we talking about? Well, in the UK alone, that number, 14%, represents the kids diagnosed with asthma. I mean, think about that for a second. That's roughly 1 in every 7 children. It's a really familiar challenge in classrooms and on playgrounds, pretty much everywhere.
And, this isn't just a bit of a cough. It's a pretty significant condition that can have a real impact on school, on sports, on the whole family's life. But here's the thing, and it's so important. Understanding what's going on is the absolute first step to getting it under control.
Okay, so here's our game plan. First up, we'll look at why it's such a common condition in childhood. Then we're going to decode that wheeze and see what's actually happening inside the lungs. After that, we'll map out the path to control, and we'll finish up by talking about how kids can really, truly thrive.
So, you might be asking, why does asthma affect some kids and not others? Well, it's not really one single thing. It's more like a combination of key risk factors that kind of set the stage for the condition. It really is a complex mix. Genetics, for sure, they play a huge part. So if asthma runs in the family, that's a major indicator. But the environment is just as critical. I'm talking about exposure to smoke, air pollution, even common allergens like dust mites or pollen. And then there's this thing called atopy, which is basically a person's built-in tendency toward allergies, and it often shows up as eczema or hay fever right alongside the asthma. We all know that sound, right? The wheeze. But what is actually happening inside the lungs when an asthma flare-up hits? It's a pretty dynamic process, and thankfully it's reversible, but it's way more than just a sound. Okay, to really get asthma, there are 2 key ideas you need to know: inflammation and hyperresponsiveness. Inflammation is the swelling and all that extra mucus that physically makes the airways narrower. And hyperresponsiveness, well, that's that twitchiness. It's the airways totally overreacting to triggers like cold air or a good run. This is exactly why treatment needs a 2-pronged attack. One medicine for quick relief to open things up, and another one for the long term, to calm down that underlying inflammation. So how do you spot it? Well, it's hardly ever just one thing. Doctors are really looking for a pattern. Are the symptoms worse at night? Do they pop up during exercise? Are there other allergies hanging around, like eczema? And honestly, a huge clue is when the symptoms actually get better after trying asthma therapy. It's all about connecting those dots. Now, with really young kids, this can get a little tricky. See, a lot of toddlers wheeze when they get a cold. That's often called viral episodic wheeze. And the good news is they might just grow out of it. But if the wheezing is set off by a bunch of different things, like dust or exercise, and it happens even when they're not sick, that points more towards multiple trigger wheeze, which is way more likely to be persistent asthma. And now for the really good news. With a proper diagnosis, asthma is a highly, highly manageable condition. The absolute key is finding the right strategy for each kid, because this is all about gaining control. And listen, the goal here isn't just less bad. We're talking about total control. That means no symptoms during the day, no waking up at night, no limits on running around and playing, and no scary flare-ups. The strategy to get there? It's not one size fits all. It's a really flexible idea called the stepwise approach. The logic behind it is pretty simple and really flexible. You start with whatever treatment you need to get the symptoms under control. If that's not quite working, you step up. But, and this is key, once things are stable and going well, the goal is to step down to the lowest possible dose that keeps that control. It's like a dynamic partnership between the family and the doctor. Okay, so asthma medications basically have 2 main jobs. You've got your relievers, which are for immediate rescue. They work fast to open the airways during an attack. Then you have the preventers. These are the long-term heroes. They work in the background every day to reduce that inflammation and stop attacks from even happening in the first place. And if we dig just a little deeper, we find a really critical safety point. The short-acting relievers, they're for emergencies. But if a child needs to use them more than twice a week, that's a huge red flag that their asthma isn't well controlled. And the long-acting relievers, while powerful, must always be used with a preventer steroid inhaler. Using them alone can actually be dangerous. But, control isn't just about medicine. It's about knowledge, it's about preparation, and it's about empowerment for both the child and for you, the caregiver.
So let's take a look at how this all works in practice.
Okay, in a scary moment, knowing how to assess an attack is step one. Can the child speak in full sentences? That's likely mild. Are they too breathless to talk, maybe using their neck muscles to breathe? That's heading into moderate. And a silent chest or confusion, that's a sign of a severe attack, and it means you need emergency help right away.
For a mild to moderate attack, the plan is clear and methodical. The most important thing is to stay calm and use that reliever inhaler with a spacer. That little chamber really helps get the medicine deep into the lungs where it needs to go. Following these steps can often turn the situation around, but it's so important to know when it's not enough and it's time to call for help. All right, if you take one thing away from our whole conversation today, please let it be this. The single most important tool you can have is a written, personalized asthma action plan. This is not just some piece of paper. It's your playbook for control. A good plan, one you develop with your doctor, lays everything out. It explains the daily meds for the green zone when everything's going great. It tells you what to do in the amber zone when symptoms start creeping back. And it gives you a clear, step-by-step emergency guide for the red zone. It just removes all the guesswork and gives you confidence. And that really leaves us with one final thought. Understanding the signs and the tools is the first step, for sure. But having that personalized plan and making sure everyone, parents, teachers, even the child, understands it, that's what creates true empowerment. Because that is how a child doesn't just live with asthma, it's how they thrive with it.